because honestly, through my study path, I've been always asked what it is genetic counseling, how do I become a genetic counselor, the role of genetic counselor, and when should I refer to a genetic counselor. So in this video, I'll be answering all these questions. If you guys want to add other questions, don't hesitate, just ask in the comment down below. So first thing first, what is genetic counselor? Genetic counselor is a healthcare professional that identify and educate, assist families at risk with many different hereditary conditions. Genetic counselors are trained to help people understand the basis of their conditions and advise them of their options and support them thinking through implications for themselves and their families for being tested or not being tested. So genetic counseling is not an individual process. It's a multidisciplinary work in the sense that me as a counselor, I'm able to work with geneticists, psychologists, nurses, and a wide range of medical professionals to give the best solution and the best treatment for the patients and their families. So based on my experience in the hospital, the counseling was an interview between me and the patients to collect data and information, document regarding their family history, and able to draw the family tree, which is the pedigree. I hope that I will be able to show it to you guys. Once the pedigree is done, we evaluate the information to identify patient and families at risk for a certain genetic condition. And we will be discussing also the risk and the probability based on the information that we obtained. And also, as we know, there's a lot of genetic tests, so we will have to discuss their limitation, their benefits, which one is suitable, and with the families, the patients, and with health care providers. So based on your personal and your family history, your doctor will refer you to a genetic counselor. And there's a lot of different stages to be, you might be referred for genetic counseling, such as planning for pregnancy, if there's any genetic conditions that runs in the family, in your family history or in your partner's life, if there's a history of infertility, multiple miscarriages, stillbirth, previous pregnancy of child with birth defect. And plus, genetic counseling can also be recommended for during the pregnancy, in the sense that if a woman has performed for screening tests such as ultrasound and blood test, and the results came abnormal, so she had to go through an invasive test such as chorionic villus sampling and amniocentesis, which the main important things regarding the invasive test is that to avoid the trisomies. The most common one is Down syndrome and trisomy 13 and 18, which are not compatible with life, and also to check if there are any abnormal in the sex chromosome, the X and Y chromosome. Also, genetic counseling can be recommended before marriage, for example, for the population such as white population and Mediterranean that have a high risk of developing cystic fibrosis and beta thalassemia, so screening test is recommended as well. And also genetic counseling is recommended for adults in so many cases, and one of these cases are cancer. For example, if we have in the family history 2 relatives that has developed cancer in early onset, so we have to check if there's a mutation regarding the gene. For example, let's talk about BRCA1, BRCA2, which is gene involved in breast and ovarian cancer. So we have to check if there is any mutation, if it's hereditary or not, because as we know, cancer is a multifactorial disorder. So there's many factors that has to be checked. Moving on, I'm going to talk about the role of genetic counselors. So genetic counselor help you cope with different situations, like make a decision regarding which genetic test is suitable, or genetic test or screening test. For example, as I said before, chorionic villus sampling or amniocentesis that has to be recommended in different stages during pregnancies. making decision before your baby is born, or caring for someone who has a genetic condition, living with a genetic condition. Me as a genetic counselor, I'll do my best to help them psychologically to deal with the situation and to move forward. So also as a genetic counselor, we're able to help you to find out if you are at risk of developing a genetic condition. For example, in cancer cases, when a patient has performed for a test and found out that has mutation involved in genes related to cancer, we can predict the possibility and the risk to develop cancer, and we're able to suggest the best treatment and options that are available, such as surveillance, chemotherapy, changing in his lifestyle as being on diet, stop smoking. Also, we can offer surgeries such as mastectomy, which by removing the breast, or oophorectomy, which is by removing the ovarian. And also, a genetic counselor can help people to communicate and support services that are present in their community. I have to mention also incidental findings where patients came to the clinic to do a test for a certain genetic condition, but we found out that has mutation regarding genes that are involved in other syndromes. So patients normally have the full right to decide if they wants to know these informations or not, by usually signing a consent before the test is done. I'll start by saying that it's a profession that is continuing to develop globally. We're started in United States, specifically in New York City in 1969, and then has been expanded to other countries such as Canada, United Kingdom, UK, and other European countries such as Italy, where my university, University of Siena, had the first and only master's degree program in genetic counseling. And to become a genetic counselor, you have to do a bachelor, which is related in scientific and medical field, followed by a master's degree in genetic counseling. It depends, the requirement depends, of course, on the country of your origin and in which country you're applying to. So if you made it to the end of the video, thank you so much. I hope you enjoyed the video. Stay safe. Bye. My study path, I've been always asked what is genetic counseling is. I've been always asked what it is. What it is? What should I say something like this? In white population and Mediterranean. Oh my god, I don't think ever.
I'm filming.
Sure?
I'm filming.